This episode is brought to you by ProMensal.
It will help the GP immediately recognise where there's something that actually needs further investigation or exclusion before we can talk about menopause. But having that really focused list of symptoms, because as you say, it is a grab bag of sometimes quite strange things that go on.
Welcome to Thriving in Menopause, brought to you by Prevention Magazine. I'm Andrea Duval, and today we're going right to the heart of the matter and looking at how to talk to your GP about menopause and specifically what questions to ask. So today I'm joined by Dr. Sarah White, who is CEO of the Jean Hales for Women's Health, which are health clinics in Melbourne. And the founder, Dr. Jean Hales, established the first Australian clinic dedicated to menopause 30 years ago. Welcome, Sarah.
Oh, great to be here, Andrea.
I imagine by the time many women come to you in your clinic, they've already seen their GP. And to be fair, GPs mostly don't get much training in menopause.
Yeah, it's shockingly little training that GPs actually get in menopause. And it really should be more than GPs who are getting that training. We know that actually a lot of allied health people, so physiotherapists, dietitians, psychologists, all should be getting training in menopause. Half the population goes through it, and yet it's a shockingly low level of training.
So let's talk about the kind of conversation you should have with your doctor. If you're listening to this podcast, you'll know that many of the symptoms of perimenopause can begin long before menopause itself officially happens, which is when our periods cease. But it's an elusive beast. It's not like the day that our periods start.
That's right.
40 odd years ago. Look, I had a female doctor, and so I naturally assumed that she, being older than me, would be cognizant of some of the strange things I started presenting with in my mid-40s. But it turned out not to be the case. Should you ask your GP if they specialise in menopause?
Yeah, it's a great question. So all GPs should be able to have some level of ability to tell you about menopause, even if it's just pointing you in the right direction to start some of those non-medication approaches to managing symptoms. If your GP flat out says, I don't do menopause, I honestly, Andrea, would be looking for another doctor, because it's 50% of the population, as I said, will go through menopause. So they should be able to tell you something. 20% of women will have really severe symptoms, and those women definitely should be looking for a specialist. And you can find a specialist relatively easily if you go to the Australasian Menopause Society website. They actually have a list of doctors, so menopause.org.au, and they'll have a list of specialists.
That's good to know, because I think one of the things, if you're in your early to mid-40s, which is the normal time for the start of perimenopause, it's not necessarily hot flushes. It's, as some of our other guests have described during this series, weird things start happening, and it's only a trained eye that can sort of put those pieces together. So if you're not getting satisfaction from the medication they've put you on, it's reasonable to put perimenopause in the picture, isn't it?
Absolutely. It's so funny, the number of women who've told me that they've started Googling early dementia. I had another friend who said to me, I think I've got this long COVID because I'm really forgetful. And I sort of looked at her and said, now, how old are you again? Remind me. Actually, I think it might be perimenopause. So there's this real lack of understanding of what the symptoms are. So if there's something strange going on with you, a whole range of symptoms can be attributed to menopause. At the Jean Hales website, we have a perimenopause and menopause symptom checklist. So go to that, tick in the boxes of what you're experiencing and how bad it is. Take that into your doctor and have a look at these symptoms together.
I love that, the idea that you can actually be on the front foot and go in there and say, look, I'm feeling this and this and this.
It really helps direct the GP's attention. It will help the GP immediately recognise where there's something that actually needs further investigation or exclusion before we can talk about menopause. But having that really focused list of symptoms, because as you say, it is a grab bag of sometimes quite strange things that go on. If you actually see that this might be a symptom and you can talk your GP through this list, that will actually help also determine the course of treatment.
I think that one of the things that some women would assume, certainly I would, is, you can take a blood test and I'm sure that'll show if you're perimenopausal, but that's not the case, is it?
No, and in fact, menopause is 12 months after your last period. So you don't know until retrospectively that you've actually been in perimenopause. So there's no blood test, unfortunately. It really is that collection of symptoms. And as I said, 20% of women will have severe symptoms, 20% of women will have no symptoms, and the remaining 60% will have a bunch of symptoms from forgetfulness, so this sort of brain fog. It might be vaginal dryness. It might be really bad periods and irregular periods. It could be a whole host of things.
So, what are the common questions a woman should ask her GP about this?
So it's really focusing on the symptoms that are the most bothersome. Unfortunately, it's super unfair. We have to put up with menopause. It is something that's going to happen. So we really need to focus on managing the symptoms that are bothersome. So if it's sleep, for example, sleep disturbances, then talking to the doctor specifically about some of those lifestyle factors. And then if that doesn't help, what are some of the medications? So it's really focusing in to the doctor on, these are my symptoms. How do I manage these things that are the trickiest? And then if it's maybe not menopause, what else do we need to assess to exclude another issue?
So it really is requiring a doctor to have a very nuanced response and not say, oh, you're depressed, take this happy pill.
Absolutely.
Right.
And one of the challenges we do have is that our Medicare system is not set up to have these long consultations. So if you're a woman who's experiencing half a dozen different symptoms that are really bothering life, it is actually not set up so the doctor can spend that time that they need to take. That's one of our challenges we have to address in our medical system, something we're advocating for. But we really, take the time, go and read lots of information, really great doctor written and edited material on the Jean Hales website, also that Menopause Society website I mentioned, really great information out there. Make sure you're armed with that information before you have the conversation with the doctor, and challenge the doctor. If they say, here's a happy pill, ask why. Sometimes you don't click with the doctor, you don't feel like you've quite been heard. We hear from women all the time who feel like they've been dismissed or disbelieved, which is awful, and that is something we do need to resolve with our learned GP friends. But if you don't feel like you're getting that satisfaction, do go to another doctor, or do look for that information, or do go and find someone who can help. You shouldn't be putting up with it, definitely not. There's going to be some level of bother, unfortunately, and we have to be a little bit resilient about some of those. But if you're really not getting the satisfaction you need, go and find another doctor.
Good advice.
We'll be right back after this.
Perimenopause can actually start in your 40s. Declining estrogen production during perimenopause brings on changes to menstrual cycles and often the onset of hot flushes, night sweats, mood swings, and sexual problems. Promensal Peri is specifically designed for perimenopausal women and can help relieve these common menopausal symptoms. Promensal Peri is available at leading pharmacies across Australia and offers a cost-effective treatment at under $1 a day. When things start to change, try Promensal Peri. Always read the label and follow the directions for use.
Okay, we're back.
Let's talk for a minute about HRT, or as it's more commonly known now, menopause hormone therapy. It's been controversial, I suppose, for 20 years since that study that suggested that it was linked to breast cancer. And tragically, I know so many women that came off HRT at the time, only, of course, for it to be, when they looked at the study, it was quite unfounded. There were so many things wrong with the study that
There were, yes.
It's quite sad. It frightens so many women. And interestingly and importantly, earlier this year, the World Health Organization actually came out and said menopause hormone therapy is the first-line treatment for menopausal symptoms.
That's
and then
right.
A couple of weeks later, along came another study which alarmingly linked MHT with an increased risk of dementia. So there's some alarm bells around that study. Can you discuss it with me?
So this is where science communication can go terribly wrong, both that initial study and the study that came out just recently. We're not trained or the general public's not trained to look at risk and understand that risk in the context of their own lives. And a study like this comes out and everyone gets super excited, and then the doctors look at it and say, well, hang on a minute, that's actually not relevant. So there was the study that came out around there might be a link to dementia. There's not. That study did not show any sort of causal link. Again, they looked at women and said, oh, look, here's a group that have dementia and here's a group that have been using menopause hormone therapy. But they didn't look to see whether women were using the menopause hormone therapy because they already had issues. There was, so the study was not good. It should not have been reported. I think that was actually really poor judgment to report that study the way it was reported. So menopause hormone therapy is something that a lot of women have this fear of. There are some women who can't take menopause hormone therapy, but most women can, and you should not be scared of it. If your doctor raises it as something that might help you, talk to the doctor about your personal risk factors, but don't be afraid of it. It can actually be quite a miracle drug for women who are suffering from really bad hot flushes, night sweats, brain fog. It can be very, very helpful.
For women preferring to go down a more natural, in inverted commas, route, what are the key elements that there is evidence to suggest are helpful?
Sure, that there are some complementary medicines. You do need to look at them very carefully. Again, if you go to like the Gene Hale's website, there's a list there of some foods that have estrogen, because that's the hormone that really drops out during menopause is estrogen. So some plants have actually the sort of like a plant estrogen in inverted commas. They can be very helpful. There are other drugs that are not necessarily menopause hormone therapy. So melatonin, for example, can really help women if they have night sweats or sleep disturbances. I always recommend people start with those non-medicine approaches to managing their symptoms first. That's what my medical doctors in the Gene Hale's clinic say. Start with those lifestyle things first and then talk about the medication. So there are things out there.
Okay, so while you're chatting to your doctor, there's almost one universal symptom that you're probably less likely to want to raise. So let's raise it now. And that is menopausal dryness. What is it? And what can they do to help?
Yeah, look, so many women are really worried about raising this, but it's a big issue. So menopausal dryness or vaginal dryness happens because when estrogen levels drop, it actually changes the tissues in the skin, if you like, in the vagina, in and around the vagina. So women will have really dry vagina when they are trying to have sex, and this is a huge cause of problems for some women, their partners, obviously, when it comes to maintaining intimacy, maintaining sexual relationships. So the doctor might prescribe some moisturisers. They might prescribe some the use of lubricants. They might prescribe like a menopause hormone therapy, which is just a cream that goes in the vagina. So there's lots of different things. Don't be embarrassed about asking your doctor about these. It's just your body. It is just something that happens in the body. Don't be embarrassed.
It's a fact of life. And as you say, half the population are women and half the population are going to go through this experience.
That's it. And the other one that a lot of women don't want to ask about is what we call vulvovaginal itching. So where it gets quite itchy around the vulva or the vagina, the entrance of the vagina, again, this is about dry skin after menopause. Don't be embarrassed. Don't be afraid to ask. Talk to your doctor about it.
So the hormonal changes that happen during menopause have an effect on a lot of things with our physical health, for example, our heart health, our bone health and body fat. What sort of tests should your GP be doing as we go through menopause to ensure we're in optimal health?
That's a really great question, Andrea, because a lot of women don't think about the fact that they're actually postmenopausal for about a third of their lives. And menopause has an effect on things after your period stops. It doesn't all, there are things that happen afterwards. So your doctor will certainly be looking at your heart health. So they might talk to you about cholesterol. They might talk to you about making sure you're keeping that physical activity up. Bone density does go down, so osteoporosis becomes a risk. So your doctor might talk to you about making sure you're getting enough calcium and dairy, that sort of thing, in your diet. They might talk to you about having a body density scan or a bone scan so they can check that you're not getting those really fragile bones and those osteoporosis risks. You mentioned weight. We all suffer with this. So menopause actually it causes the weight to redistribute, and unfortunately that goes to around the middle where it's most unhealthy. So it's really important, unfortunately, to keep on top of that diet and just keep a really good, strong eye on what you're eating. Looking at reducing alcohol, really trying to have that great diet of plants and fewer carbs, all those sorts of things that you read about.
when we're dealing with so many different symptoms is almost like the same as taking your car in for its annual checkup, that which you advocate that at this point in life women should be getting an annual checkup just to see how all of these different things are travelling.
Yeah, look, talk to your doctor about it, because some women will need to go in more frequently than others. But this is a time in our life when we really do need to be doing things like taking our cervical screening test, doing our bowel screening test, making sure that we're watching that alcohol intake. You know, if you're still smoking, for goodness sake, definitely stop that. Physical activity, those healthy guidelines, and then, as you say, the doctor's check. So getting your blood pressure checked, your cholesterol checked. Talk to your doctor about this maintenance. And we women are really bad at putting ourselves last and getting, life gets in the way. It's really important that we're looking after ourselves.
Is there anything else that you'd recommend to women looking for supportive healthcare during this time?
Yeah, look, sometimes I think it's just doing a bit of doctor shopping to find someone that you really you're going to click with. You develop that level of trust, and you find a good doctor, and you stick with that doctor. That's great to have a doctor that knows you and can help work with you when something isn't quite the same as it used to be. If you're not getting any luck, particularly around menopause, as I said, go and find a menopause specialist doctor. If it's a Jean Howe's clinic or it's going to the Menopause Society, that can really help. And look outside too. There's a lot of physiotherapists, for example, who have specific training in pelvic floor, and we know that incontinence and other issues become problematic after menopause. So go and have a look for a physiotherapist maybe who you could work with on your pelvic floor strength, for example. But definitely prioritise yourself and take the time to look after yourself.
We'll be right back after this. Okay, we're back.
Can we talk for a minute about Women's Health Week, which is coming up? Tell me a bit about it and how women can get involved and what they'll learn.
So Women's Health Week is a national event, and that's Jean Howe's runs that National Women's Health Week with funding from the Australian government. And it's really an opportunity for women to get together to learn more about women's health. So for many, many decades, if not hundreds of years, medicine has focused a lot on men. So drug trials are done predominantly in men. Things like menopause are vastly underdone when it comes to research and, as we've discussed earlier in the program, training. So Women's Health Week is really an opportunity to focus on women's health and get everybody thinking about women's health and gain knowledge. So this year we're going to have a whole range of information going out on just really general knowledge about women's health. So we'll encourage people to look at the website, find an event, host an event, just take an opportunity to get together and talk about women's health.
And for those interested, we'll have a hyperlink on the show notes so you can find out how to get involved there. Sarah, thanks for joining us today. That's all we have time for. If you've enjoyed this episode, why not subscribe to the podcast series? And for more great information about living your best life at midlife, pick up a copy of Prevention Magazine. I'm Andrea Duval, and I'll see you next time.